The Interventions Testing Program, or ITP for short, is a program that was developed over 10 years ago now to investigate the potential for compounds and dietary changes, compounds that are provided in the diet, to extend lifespan in a mouse model. We use males and females, and this is, of course, a very important topic that the NIH has recognized recently to promote. And we've done this from the beginning, putting in enough males and females to have equal numbers going through the study and come out so that we've got statistically relevant numbers of both males and females for the analysis. By having both sexes involved from the beginning, this was something that was recognized early on as being important. I do believe that having both males and females included in these studies is very good science. It's essential for what our goals are, but I think it's something that any experiment in an animal model has to consider. The sex differences that we've seen so far to date, as I mentioned earlier, of the first 5 compounds, and this is 5 out of 20 some odd. So we were actually quite surprised that we found as many compounds as we did that gave a positive effect, even if it was only in one sex. But we were really quite surprised that out of those 4 out of the 5, we only saw an effect in one sex or the other. One example of that is aspirin. Now, aspirin has got a lot of biological activities that might be playing into its role. It's an anti-inflammatory, of course, and it's known to be protective to many health outcomes, many diseases. So we were quite surprised, since we certainly all know that aspirin is prescribed for people who have had heart attacks as a way of hopefully reducing the chances of the next one. And yet here we had a result that indicated there was, at least for our outcome measurement, lifespan, there was a big difference. Males, there was a positive effect. Females, there wasn't any. Rapamycin also, as much as it was positive in both males and females, the effect at lower dose was much more robust in females than in males. At high dose, it was pretty much the same, but what we saw was a 4-fold increase in the actual blood rapamycin level in the females. So there's probably an effect on the receptor kinetics, what the affinity is of the drug for the receptor. For the most part, what we've seen is quite a big difference in the response between males and females. And it could be, there are many different reasons why you could see this sex difference. One would be simply that the compounds are metabolized different in males and females. And you would see that in the blood levels. And we've seen that in multiple drugs. But it goes much further than that. So an example is NDGA, which is an antioxidant, anti-inflammatory molecule. Again, extends lifespan in males, but not in females. And one of the first things that we discovered in that pilot study was that the females, the blood levels were much lower. So later on, we did a dose-response curve and saw that we could come up with a dose that would give equal blood levels to what we see in the males at the lower dose. So we did a lifespan study with the high dose in females, the lower dose in the males, getting the same blood levels. Still no effect in females. So there's likely to be many different ways that the sex difference is manifested at the molecular and cellular level. When you're studying any biological phenomena, I think that you have to consider at some point the study of both sexes, and the initial results will then instruct how much both sexes should be involved at each of the succeeding stages. But it's a variable that has to be taken into account. And you can't really understand if there's an effect unless you do the analysis separately. So you really have to at some stage, hopefully early on, you have to be able to look at statistically relevant numbers of both sexes in order to really have a firm idea of what the impact is.